Hi everyone, so for today's In Conversation With, we thought we'd mix it up a little bit. Normally we talk about how we have chats and how we can make patients better, but today we thought we'd talk about the evolution of us as therapists. So within the clinic, I think everybody's been through a bit of an evolution from where they started originally to where they are now. So I started as a sports therapist and retrained as an osteopath 10 years ago. Bridget, you originally...
I did sport and exercise science. That was my initial degree, and then went and did the sports therapy afterwards, a year later. So yeah, went on to that as a career.
And then I am a sports massage therapist, which I trained later on in life to become, and now I'm studying to become an osteopath.
So what you can see is that we share all of these. Essentially, we're a big Venn diagram, and we all do CPD, so continual professional development as well. And one of the reasons the three of us thought we'd join you today is that actually we all started off in elite sport as well. So you were with Chelsea football?
Yeah,
with the women?
And Watford, yeah, and a few other little clubs.
Robyn, you did?
I was at Southampton, so I worked with the first team for a season and a bit with Southampton, and I'm currently doing work with the Women's England cricket as well.
Which is super cool.
I haven't done elite cricket.
I haven't done elite sport for a long time, but I think for me, it sort of shaped where I wanted to go in my career and how I wanted to work. And I think you guys are the same. The reason you're becoming an osteopath is because
I'm bored of picking your brain because I don't know the answers. Because every day I come in, I'm like, I need to know something more, and it just gives me that extra bit of more knowledge, more progression, and just a better service to my patients, honestly.
I guess that's where, again, I've upscaled, my treatments and done the dry needling because the osteopaths do it, and I wanted to know more and be able to use it as treatment as well.
So I think most people who come into this world we tend to be curious people, so we're curious in how to help people progress. And I think the other In Conversation With chats, I've personally learned quite a lot from them, and as a result gone away and done some more training and done a little bit of reading. And I think we wanted to sort of show you guys that doesn't just look like a video on YouTube, but actually it kind of changes us fundamentally. As you said, you did your dry needling, medical acupuncture, becoming an osteopath.
Yeah, and I studied Pilates as well, so I'm a Pilates instructor too, because I think, like you say, you're just a bit more curious about the industry and how to get better and how to get your patients better. And I think there's so much information out there that having a mixed tool bag just lets you provide more better care for other people.
Absolutely. And there's a continuous process of change. So the therapists we are today might be very different therapists to the ones we will be in a year or so's time. And medicine changes so quickly. Things I learned back 20 years ago at university are fundamentally different to the stuff you're learning today in uni. So yeah, what I wanted to do is show you that this is an evolving world, and in the clinic here, as I said, we fit kind of into a Venn diagram. A lot of the treatments I do cross over with the treatments you do, and the exercise advice that you give, and really, if you see us asking, if one of us asks you to go and see one of the other therapists, for example, if I refer you to Bridget, it's probably because actually the skill set that Bridget has is more specific to that need, and
vice versa, isn't it?
Vice versa, exactly. So I think that this big Venn diagram with acupuncture, the traditional acupuncturists, the medical acupuncture, osteopaths, massage therapists, sports therapists, what we're trying to do is create a sort of a culture to help you guys as much as we can.
So we'll work cohesively with each other as well, don't we? We all communicate. Like I'll have a patient I'm sending Joe's way, but I'll then speak to Joe beforehand and give him a bit of a briefing on what I've found, and then it kind of helps to make sure that what you're going into has got as much knowledge as possible for it.
Absolutely. And I think
I was going to say, it also comes down to the patient population. So for example, pregnant ladies, I've done anti-postnatal Pilates, so give exercise advice. Someone else might be able to do more treatment related to pregnancy. Children, doing courses on children, paediatrics, etc. So yeah, depending on the population, different people might be better for that person.
And what interests us personally. So this evolution has taken me 20 years and will continue, and I think you're...
So you're about 15, 16 when you track. Yeah, about that many years.
I think I'm 8 years in.
And very new into your osteopathy.
And incredibly new to that, yeah.
As we evolve, we sort of shape ourselves into our own personal interests, and that allows us to share that knowledge within the clinic. So that's why I really wanted to talk to you guys today. So yeah, hopefully it shows that as a clinic we evolve. You know, I was a sports therapist, became an osteopath, sports exercise scientist, became a sports therapist, and a massage therapist turned into an osteopath Pilates teacher. So yeah, hopefully that sort of shows the evolution of therapy as we know it, and yeah, and for the best for the patient. So yeah, good to talk to you today,
Absolutely, perfect.
Thank you.
and we'll catch up with you soon. Take care.